Okay.
Okay, we are
Can
live.
we start?
Yeah, we are live. Good afternoon, everyone. Today's session is going to be really helpful and is led by Dr. Garima from Apollo Cradle and Children's Hospital. She is going to talk about knowing your sexual and reproductive health. So stick around until the end and ask us questions if you have any. Doctor, you have the stage. Sorry, guys. It seems to be an issue from doctor's side. She'll be there. She'll be here in 2 minutes.
सेटिंग में
नहीं हमारा ठीक आ रहा है लेकिन
नहीं ये नहीं चल रहा है, ये आपका फ्लैप का कैमरा है, इसका कैमरा एचडी है। It's not showing. Not showing? क्यों? Started live.
yeah we are live only.
You see,
Hello.
we'll see now.
Okay. Right. She's messaging me. Yeah. Good evening, everybody. I am Dr. Garima Jain, Senior Consultant at Apollo Cradle Brookfield. Today, I'm going to be talking about a little different topic, what you would have heard all these while on an Apollo Cradle Facebook page regarding pregnancies and women health and everything. Today's topic is going to be about awareness about your sexual health and reproductive health. The reason why I've chosen this topic for the talk today is 12th of February is the International Sexual and Reproductive Health Awareness Day. So we thought let's try to connect with our people about the same thing because technically there is a lot of lack about the sexual and reproductive awareness and sexual health and reproductive health awareness kind of a thing. It is very important that we need to know about it, and this year's theme for this day has been chosen as sexual health is for everyone. So when we listen about sexual health, generally we all think, oh my God, especially in our Indian scenario, talking about sexual health is a taboo topic. Everybody thinks that, oh my God, why is somebody talking to me about sexual health? More often than not, the information that somebody gets about sexual health as a teenager or otherwise is from friends, from colleagues, from social media, rather than getting it from the right places, and they'll end up with a lot of trouble because of it. However, sexual health and reproductive health does not restrict itself to only the so-called sexual health that we think of. There is a huge thing about sexual and reproductive health. It covers a larger scope, starting from covering about the pregnancy, covering about the sexually transmitted diseases, covering about taking the consents about sexual health and reproductive health, body shaming or body shape, or that's again a big thing when it comes to sexual and reproductive health, relationships, having sex, safe sex, contraception, having a healthier sexual life. All of these are very important, and these are the topics on which vastly we can speak about it. Obviously, it becomes a very, very vast topic, and it's not possible for me to cover everything in it. But I would like to brief up a few things in this short span of 20-25 minutes that we can try to cover. Now, awareness to increase awareness of this thing, awareness of our sexual health and reproductive health is important to is everybody's responsibility, and it makes it easier and better for us to have the right choices. To start off today, I don't know how many of you have been into reading about the latest media news of today. We lost a young person, 32-year-old Mrs. Poonam Pandey or Miss Poonam Pandey, and she died of a cervical cancer. Now, had she been aware of her sexual health? Had she been aware of her reproductive rights, had she been aware of what it is important to protect yourselves as a teenager or as a youngster, maybe we would not have lost her so young. So to start off, we know that cervical cancer, unfortunately, is the second most common cancer among women. And cervical cancer almost always comes because of a particular viral infection called the HPV virus, the human papilloma virus, which can happen otherwise, but more often than not spreads through sexual activity, having multiple partners, the not the so normal ways of having intercourse. These are the reasons why you land up with having an HPV infection. And let's face the facts clear that we are becoming a Western culture, having multiple partners, having living relations, premarital affairs, postmarital affairs, um, divorces, one night stands definitely are becoming much more commoner in our country and much more openly being accepted as compared to before. Maybe earlier also the incidence was there, may not be as high as now, but earlier it was still a taboo thing and people would hide themselves from it, and therefore many people would not even get involved into it with the fear of it. But now that, especially in the cities, it has become an openly accepted thing, we do find that and with awareness, with the internet connection reaching every nook and corner of the country, unfortunately, everybody speaks and talks about having a girlfriend, boyfriend before getting married, having and being in a relation, living relation, starting off being sexually active as young as during their teens, and landing up with wrong things, kind of thing. So HPV viral infection can happen to anybody, though more often happens when you are sexually active when you are younger, when you have multiple partners, and therefore you can land up. And if you have this infection, your risk of having the cervical cancer multiplies by almost 7-8 fold times. Almost 98% of the cervical cancers happen because of this particular viral infection. Yes, so we are talking about it, that we would want our teenagers and young population to be protected from having multiple partners, and using safe sex, using barrier contraceptive while they are being together would definitely help to prevent the spread of this HPV infection. Trying not to have multiple partners would also help us to prevent from having this infection. And there is a vaccine in the market for the last 20 plus years with its safety proven to protect from HPV vaccination, HPV infection. Unfortunately, the vaccine is slightly on the expensive side, and therefore still in our country it is an optional vaccine. Kudos to the budget yesterday. Yesterday, the government has declared that this HPV vaccine now will be available in all our government setups between the age of 9 years to 14 years, the targeted population of girls that we are trying to protect from this infection free of cost. And once it is there that way, I'm sure the rates of the vaccination would also drop further, making this vaccine much more an affordable vaccine for almost everybody. So we hope that soon we will be able to protect almost all our girl child from this infection. Now, is this vaccine important only for the girl child? No, this vaccine is equally important for the boys also, because the boys also can get this infection. And when these boys do get these infections, they can also have genital warts, they can also have penile cancers, they can also have cancers of the anus, they can also have nasopharyngeal cancers, and therefore protecting the boys is also going to be equally important. And we are hoping that soon the vaccination for the boys would get included into the optional charts. Though, yes, even now we do talk to parents about it, but then it's still not there in our charts, and therefore the hesitation to take this vaccine among the boys is still there, or by the parents for the boys is still there. The advantage of taking this vaccine is best when it is taken younger. If this vaccine is taken before the age of 15 years, it would be 2 doses of vaccination. However, if taken after the age of 15 years, this vaccine would require 3 doses of vaccination to protect you from this cancer, which is a 100% safe vaccination to be taken anytime between the age of 9 years to 45 years. So the first thing is protect yourselves. Having safe sex is very important. And along with having safe sex, it also becomes important to protect yourselves from getting this viral infection by taking the vaccination. Now, when there are multiple partners involved, obviously or when intercourse starts happening or sex starts happening younger in life, the risk of STDs, sexually transmitted diseases, also increases. Earlier, we were having a huge outbreak of STDs in the form of gonorrhea, syphilis, but of late, the STDs have changed to having HIV, hepatitis B. These are all infections, and the HSV infections and the genital warts, all of which can come in by having multiple sexual partners, getting sexually active younger in life, and therefore protecting yourselves by using adequate barrier contraceptive, using the condoms would probably help to prevent these. And we have vaccination for the hepatitis B infection also. Now, it is the right of every person, man or woman, boy or girl, to know about safe sex also. So, safe sex is something which is important that everybody should be protecting themselves. When we say safe sex, it is not just safety from the point of view of infections. We would also want to talk about safety from the point of view of getting pregnant or not getting pregnant. Pregnancy should be something which happens by choice. It should not be something which is inflicted upon anybody. It should not be that, oh my God, I'm pregnant. Especially when we look at teenagers, when we look at young college students, when we look at people who are not yet married, and all that, we do find that unfortunately, more and more younger people are getting pregnant, and the incidence of going through abortion is definitely increased. What we have found that yes, in our country, because of being a relatively liberal country, because of trying to help reduce the population explosion, because we have always respected our women and we have given our women lots of rights as compared to many of the so-called civilized nations. We have allowed in our country a woman to have a right about her abortion or a right on her to decide about her family planning or going through a family planning surgery or a family planning to protect ourselves from an unwanted sex. But yes, it would be also have better if these decisions are made as a conscious effort with the family being involved, or rather, at least both the partners being involved into it. So, contraceptive is something which again needs to be talked to, should be discussed with teenagers also. Not that, but I mean, like we would say that if I'm discussing a topic of contraceptive in a teenager population, maybe I'm making them more aware about sexual health. Maybe I'm trying to tell them, go ahead, be sexually active, we are there to protect you. No, but the fact is that they are anyway aware of sexual health, but they're not aware of the safe contraceptives that one can take to protect themselves from preventing them from getting these things. So contraceptive awareness is something which should be discussed even in the younger population. And definitely in the married population, this is something which we find very, very rarely we do find a young married couple coming to us discussing about contraceptive. They feel it is not needed. They feel their information that they get from the social media is enough. They feel that, oh, my friend told it is okay. These are the safe days. We can be together without getting pregnant. Maybe I can pop in an emergency contraceptive pill, which is easily available in our country of the counter. Maybe I can take the abortion pills if at all I do get pregnant and land up with all kind of issues. So we would be happier to say that contraception is an equally important part of a gynec's clinic. Maybe even the general physician should be talking a lot more about contraceptive, and it would make good if we could talk more about contraceptives in our colleges, and maybe when we are like we do the health talks in lots of places. And what we'll end up is everybody wants to avoid this topic and everybody wants to talk only about breast cancer, cervical cancer, talk about big diseases in the pregnancy, but contraceptive being a day-to-day thing is rarely discussed in a right way. The fact is that in our country, 80% of the pregnancies are still unplanned pregnancies, in the sense that the woman gets pregnant, and that's when they realize you're pregnant and you need to be starting to see the doctor, even if they're married. And then the dilemma starts of it's an unplanned pregnancy. Should we keep this pregnancy or not keep this pregnancy? So the prerequisites to have a healthy pregnancy has not happened. The prenatal vitamins have not happened. The investigations have not happened. And what we are finding is definitely with more and more people choosing to get pregnant a little more later in their life, more and more changes in lifestyle, more and more issues coming up in life, more and more stress coming in. The incidence of picking up young diabetics, the incidence of picking up young hypertensives is very, very high. Uh, in fact, in the last 1 month, I think I have picked up four young girls, I mean, like young women between the age of 26 to 30 who came to me with a pregnancy. And when we investigated, they were diabetic. And the problems with diabetes in pregnancy are their own huge ones if the care has not been provided adequately. Unfortunately, one of them has landed up with a missed abortion, which is something which can happen because of a high level of diabetes. Uh, do have a few of them who in the previous pregnancies were unplanned pregnancies, landed up with abnormalities in the babies, and therefore we would like pregnancies to be planned pregnancies rather than that unplanned ones. Therefore, being aware of your own reproductive health is equally important to have a healthy planned pregnancy. So we would encourage that every couple, every young person should visit their gynecologist or a GP with whom you are comfortable to discuss about your contraception, to discuss about your health before you plan your pregnancies, to get your investigations done, to get all your prenatal vitamins done so that you are on the healthier side when you are looking at wanting to get pregnant. The next important thing is, which I would like to focus on, I mean, when it comes to sexual health, is about consents, right? Yeah, sexual relationships should be with a consent. It should be a mutual understanding, and there is a law in our country to the same effect. Any act of sexual intercourse happening without consent, even if it is under an intoxicated state, even if it is an inebriated state, is not considered normal. Even sexual act happening without the consent in a marriage would be considered abnormal. And yes, there are cases in the court where women have gone ahead and kind of said that sex was inflicted on me post marriage and it would be considered as rape because it was without my consent. Even after being married for 10 years, having children, then having sex should be a mutual understanding and it should be a consent. Marriage implies consent, but it does not imply the freedom to be having sexual intercourse without the consent. If a woman says no, it means no. If a man says no, it means no. So this is again something that we need to be aware of it. Yes, obviously we don't want that everybody should be going ahead and every time before a married couple saying, oh, can you consent to have sex with me and then going ahead. But definitely if the relations are strained out, if the woman is or the man is not in for it that day, the consent should be implied, and then they should be willing to say that, okay, yes, this should not be forced on the women. Similarly, we have talked about safe sex, we have talked about STD prevention. Okay, now then the next thing which we would like to talk about is body shape and body shaming, which is again a part of sexual and reproductive health. Everybody needs, and like, yeah, today's population, everybody knows what a boy is and what a girl is and everything. There's a lot more scope to this about the LGBTQ community, which I wouldn't want to touch in this topic at all because it's a huge topic on its own. But then, yes, unfortunately, body shape is again something which is equally important when it comes to sexual and reproductive health. We need to understand that women need to know that once you are pregnant, there are going to be changes in your body. Once you are sexually active, there are going to be changes in your body. You need to be aware of it that when you are pregnant, you're going to be putting on weight, you are going to have a little change in your shape, you're going to have stretch marks coming in on your body, you're going to have stretch marks coming in on your breast, you might have a little bit of sagging of your breast, you might have your vagina getting looser, you might have all those kind of issues coming in. So this is something what we are realizing that maybe because of the way fancied presentations happen in the social media about pregnancy, that you're pregnant today and everybody's pampering you, and tomorrow, second day, within a week, your tummy shows 9 months and it's a big tummy there, and everybody's fancying you, everybody's pampering you, and then post delivery within 5 minutes, you're back into shape, full makeup, full glamour look, and everything. And yes, with all the high standards set up by our influencers, the actresses, the Bollywood, and everybody else. Unfortunately, I mean, like, they get back into shape quick, but they don't photograph themselves, they don't present themselves when they're not yet in shape. There are very few of them who could stand tall and say, Don't body shame me. There is no need to body shame me if I am fat in my postnatal phase. Don't body shame me if I did try for a normal delivery or I had a normal delivery. For that matter, yes, Aishwarya Rai is one lady I would say who did care to push, have a normal delivery, did not go overboard in losing weight, took her own sweet time, 2 to 3 years before she got back into shape, so-called shape, and did not appreciate anybody body shaming her, saying that you're still so fat. She just stood tall and said, yes, this is what I am. I am a mother. I am breastfeeding the baby. This is me. This is how I am going to be. And women should accept these changes in their life to be able to feel good about themselves and not feel upset that, oh my God, my body is like this. And how will I go back to work after 6 months? Or then we do find lots of women feeling that, like the doubts that women come to us, like, madam, when I'm breastfeeding the baby, I might have a little milk staining on my clothes. How do I start working? It looks so odd. How do I breastfeed my baby when I'm in a public space? How do I manage? Suppose in my pregnancy, I suddenly start bleeding, or suppose I have my water bags breaking. Everybody will stare at me and say, oh my God, this lady is in a mess. We need to understand that if the awareness of this is there, instead of the woman feeling embarrassed, instead of everybody staring at her and saying this is wrong, we might be all able to help her in a better and healthier and happier society. So, awareness about your own sex, whether sexual health, awareness about your own reproductive health is very, very important. So, to starting from your teenagers, knowing that you need to vaccinate yourselves and protect yourselves, knowing that you can protect yourselves from the genital warts, you can protect yourselves from all the STDs, use the right contraceptives to make sure you are healthy and you don't land up in trouble. Being aware of it that you could land up with a pregnancy even as a teenager or even in a one night stands. There is nothing like a safe period. Yes, there are morning after pills, but then they're not the best ways of contraception. Making sure that you consult your doctors and use the right contraceptives so that you don't land up with an unwanted pregnancy. When you are getting married, meeting your doctor so that you are aware of uh, what it is going to be post marriage, educating the younger girls about their menstrual cycles. All these things are something which are very important, which are kind of tabooed in our society, still not open out, talked about openly. Child marriage is still a fact in our country, though the POSCO Act is there in place, which kind of says that if anybody gets married younger than 18, is pregnant younger than 18, should be reported. But even in a city like Bangalore, we do still see more and more, we do still see occasionally, not very often, but we do still see girls coming into us in a married relation even before they are 18 and already pregnant. And then it becomes very difficult for us to justify what is happening with them. Unfortunately, if we bring about this awareness, if we talk about this to our girls in their school, if we talk about this to our boys in their school, in their college, if we can bring about this awareness in every panchayat, in every place that is possible, we may be able to help and understand why child marriage is bad for the boy and the girl, why child marriage is not good for the health, why the body is not ready when you are very young to go ahead and become a mother or a father, when you are very young. Maturity, both mentally, physically, and today's world financially, is also something which people need to understand is equally important when you are going to become parents. Having a healthy parenthood by meeting your doctors before planning your pregnancy, getting your investigations done, your prenatal vitamins, going through your reproductive process while seeing doctors, trying to avoid domiciliary deliveries and therefore preventing maternal mortalities, infant mortalities, stillbirths, IUDs. All of these is a duty that is bestowed upon all of us, and each of us should try to bring about this awareness and take care of it. Equally important, we do find occasionally couples coming to us not managing to even have intercourse after being married for a few years because the awareness of sex is not there in them. They don't know how to have sex, some of them. They're scared about having sex. The girl has been brought up saying having sex is a taboo. The boy thinks having sex is unhealthy. Being brought up as a child told, no, this is something which is not good. This is a bad thing. This should not be happening. So even after marriage, they're not able to get into a married relation. They're not able to proceed further in their life. The fear of getting pregnant if they have intercourse. So We do find occasionally couples who come to us 4 years of married life not being sexually active. Why? Because we were scared about getting pregnant. We didn't want a pregnancy and we had no other choice, so we chose not to be sexually active. So this is not the right way of life. So this is not how it should be. And post delivery, being taught about contraception, healthy ways of preventing pregnancies till they're not ready of it, for it, post abortion, being talked about contraception, equally making aware of the women about the HPV vaccination, talking about the hepatitis B vaccination. So these are few topics that would be huge and would need to be covered. And yes, it is a very huge topic and difficult to cover all of this in a small talk like this. But a brief of these topics is what it is. And those who are listening to this talk, you're most welcome to connect back to your doctors to know more about these things. It would be appreciated if more and more younger couples, younger people, younger girls and boys, younger adolescents do get aware of their sexual and reproductive health. Bringing about awareness of it is equally important. Just celebrating one day saying that sexual health is for everyone or reproductive health is for everyone may not suffice. However, at least it's a good initiative which has been happening for the last few years. And there are sexual awareness weeks also which are celebrated by various countries at various times. We are still following the Sexual Awareness Day, which is celebrated, which was started in Canada and, if I'm not mistaken, in Spain as on 12th of February. That's how we are celebrating, or we are wanting to bring about the awareness about sexual and reproductive health. And this talk is just a beginning to the awareness that we could bring in. Take home messages, take your vaccinations, have safe sex, know about your body, plan your pregnancies, use your contraceptive, have safe pregnancies, and so that you can be healthy and you can be healthy mothers and healthy fathers and healthy boys and girls and healthy young women. I'm good. I would be stopping the talk here. I don't think we have too many questions.